This module's purpose is to introduce you to the FIU College of Medicine's revised assessment form, the Clinical Assessment of Student Performance, or the CASP. The CASP helps you to assess the clinical skills and professionalism attributes a student demonstrates during their time with you. But first, why should we all care about getting reliable and real information about what students show that they can do in the clinical setting? Basically, because that information is really important to everyone who cares about the quality of medical education. It's certainly important to learners to help them in developing as physicians in training. Reliable information is important to FIU's clerkship directors and the curriculum developers so that we know how we're doing in preparing students to learn with you. It's important in helping us identify those very few students who really need special attention or extra help from clerkship directors and clinical faculty in order to move on to residency and ultimately safely take care of patients. Our quest for accurate information has led to our Reaching Real ratings, helping our students do their best campaign. Like medical educators around the country, we're learning some lessons about how to help you most efficiently communicate reliable information about students' performance. Some of those lessons have to do with how we structure the clinical assessment form. With your input, we've revised our assessment form, so hopefully it's more user-friendly, and we made some changes to how it's scored. So what is the CASP? That's what we call our Clinical Assessment of Student Performance. The CASP has 4 sections listed here. Like forms you've seen before, the CASP asks for your comments about the student's strengths and areas for improvement. And it's got questions on clinical skills, like taking histories, and finally, professionalism attributes, like truthfulness and conscientiousness. This is the first section, the narrative comments section. We ask that you comment on what the student does well and on what the student can improve. We also ask about what procedures, if any, the student performed while working with you. And the last comment box asks you to tell us about one patient encounter with the student that stands out to you. Just 1 or 2 details here can go a long way to helping clerkship directors and students understand what you feel is important. If you are receiving the CASP electronically, remember the option of using your smartphone to dictate comments. All you have to do is click on your dictation button and dictate your comments directly into the CASP. Be sure to read over the comments because dictation is not perfect. But don't worry about spelling or anything else. We'll figure it out. After the narrative comments comes the second part of the CASP, with questions on 8 aspects of the student's clinical skills. These aspects are interprofessional and communication skills, history-taking, interviewing, physical examination, forming an assessment, making a management plan, oral presentation, clinical documentation, and ability to work with others collaboratively. For each of these 8 questions, please always remember that you have the option of checking unable to determine, and rest assured that picking this option will not lower the student's grade, and we want you to feel free to do this if you didn't observe the student in that skill. Instead, the score will be adjusted by increasing the value of the items that you did observe and rate. If you are able to assess a student for a question, then there are only 4 options to choose between. How does this form determine the student's score? For items about clinical skills, specific number points are assigned for each rating. This total is then turned into a score that is part of the clerkship grade. We've designed the answer option so that the majority of our students will be marked at this option for all of the categories, showing that they are learning what they are supposed to be learning in the 3rd year. When you rate a student at this level, the points you get will result in a strong overall clerkship grade, more than enough to support them in matching into good residencies and moving on with their careers. If you rate a student as low or high performing on any questions, it's very, very important that you give a detail or two to explain that rating in the narrative comment box. When you forget to provide these comments, the clerkship coordinator may be in touch with you to ask for a few comments to help support your ratings of the student. We really need you to help us identify those few students who need extra help and as early in the clerkships as possible. Several of the questions refer to simple and more complex cases. What is simple and what is more complex? In previous years, we used the term complex. With your feedback, we've edited this phrase to more complex. We also clarify this term more complex as those cases with 2 or more medical problems, uncommon diagnoses, multiple medications, treatment resistance, treatment complications, or other extenuating factors for the student's level of training. Next, we ask about how much you needed to help the student in obtaining the history and performing the physical examination. This will not be factored into the student's grade. Rather, it's a new approach to getting reliable ratings, and we are simply curious to see how our faculty use this question. We understand that necessary supervision can vary with factors beyond the student's control, such as how complex patients are and how comfortable patients are with seeing students. The last section of the assessment form consists of the items assessing student professional attributes. These are things like truthfulness, commitment to self-improvement, discernment, conscientiousness, accountability, respect, adherence with site and clerkship rules, punctuality, attire, and attendance. With your feedback, we've reduced the number of these questions on the CASP. The first question in this area asks if you have any concerns about the student's truthfulness. If you do have any concerns, we ask you to give us a little more information about your concerns. These items are not factored into the score that this form contributes to the student's grade. Rather, the clerkship director looks at your ratings for these items, and if your mark here suggests that you have concerns about the student, the clerkship director will likely contact you for more detail or clarification. If the clerkship director judges, after looking at all the assessments a student receives on a specific rotation, that the student has demonstrated concerns around professionalism, they will consider deducting a small number of points from the clerkship grade. More importantly, they will be talking with the student to find out if there are any underlying issues that need to be sorted out. So the bottom line is that your ratings here do not translate directly into points for the grade. Rather, these ratings are holistically considered by the clerkship director to adjust the grade for those few students who are exhibiting evidence of unprofessional behavior and to help students to grow as clinicians in training. Let's talk a little bit more about narrative comments. Your comments are crucial and allow the clerkship director to both provide feedback to the student and to help the student improve as a clinician in training. As we've already discussed, assessments are based on your direct observation. Comments which include specific details that you observed and how you judge those observations are quite meaningful. As we've already noted, your comments provide feedback to the student and also help us know why you rate a student as very high performing or very low performing. That is, your comments are necessary to justify these outliers. Why did you feel this student's performance was outstanding? Why did you feel that student's performance was not adequate? Comments also allow you to check your biases. For example, if you've just worked with a challenging learner, you may be so relieved to work with the next learner who is not as challenging that you award high marks. Then, when you are writing comments, you realize the learner's performance is average and you can appropriately adjust your marks. This is a way your comments can help you to check your biases. We offer free CME for completing an online teaching module entitled Narrative Evaluations of Student Performance, which can be found at this website. This module takes you in depth into writing narrative comments. To complete the CASP, you will receive a paper CASP or an email that looks like this. One way to be efficient in completing the CASP and including comments is to click on this link on your smartphone. And again, then just click on your dictation button and dictate your comments directly into the CASP. Read over the comments because dictation is not perfect. Let's look at sample narrative comments and consider how we can improve these comments. How can these comments be improved to make these comments more meaningful? Just by adding a few details, these comments become meaningful to the student and the school. Now there is an example of 2 cases in which the student was able to quickly obtain a history and physical examination, and the student has clear details about how to expand the differential. Also, we added a new box asking you to please comment on one patient encounter with the student that stands out to you. Here's an example of just such a patient interaction. In just 2 sentences, the faculty describes a patient interaction that is uniquely specific. This is exactly what we are looking for, a quick comment detailing the student's strengths. We'd love your feedback. If you would like to let us know how this form can be further improved, or if you have questions or concerns about working with or assessing students, you can contact us. We'd love your feedback.